Hi, my name is Molly and I'm an occupational therapy student at the College of St. Mary. I have teamed up with Kohll's Home Care and Pharmacy to provide knowledge to patients on different pieces of adaptive equipment that can be purchased through Kohll's for use in the home. I will be covering mobility equipment, some bathing equipment, and a few pieces of dressing equipment. Just follow the links below to find more information on the equipment you have purchased. Now we're going to discuss the use of adaptive equipment for bathing. Adaptive equipment for bathing can include a shower bench, grab bars, long-handled sponges, and handheld shower heads. Getting in and out of the bathtub can be very risky. Slick surfaces can lead to increased risk for falling. There are many pieces of adaptive equipment that can be used to reduce this risk. One of them is grab bars. Grab bars can be put on the side of the tub like this. There's also a grab bar down here on the inside of the tub, and grab bars are often also put up on the walls in a bathroom to allow for something for a patient to grab onto for steadiness. Shower benches can also be used to greatly reduce the risk of falling. Shower benches can be used to sit on when you get into the shower, so you're not having to stand over a slick surface. They can also be used if you have low endurance or cannot stand for long periods of time. It makes showering a lot easier. If you decide to stand in the shower, there is also non-slick mats like this that you can put down in the shower, which can reduce having to stand on a slick surface, which will greatly reduce your risk of falling. Getting into and out of the bathtub can be very risky, especially when you have an injured lower extremity, and that is often when you need the use of adaptive equipment. Depending on the setup of your shower, depends on which side you get in on. For example, if your shower head is on this side, you'd want to get in facing your shower head. If it were to be on the opposite side, you'd want to get in the opposite way. You always want to be facing the shower head. Now that also depends on where you put your grab bars. Grab bars like this are detachable, which means they can be moved. If you have grab bars installed, you need to map that out ahead of time to make sure that they are installed in the correct places. Okay. When getting into the shower, you always want to try to lead with your strong leg first if you have an injured extremity. And sometimes that's not always possible. But if it is, if you're leading with your strong leg, you can always brace yourself with a grab bar. So you brace yourself with a grab bar, put your good leg in first, trying to put as much pressure through your arms and things to take weight off of your bad leg. And then it's sometimes easy to sit down and aid your other leg into the shower, like so. It can also be helpful if you have grab bars up here to hold on to while doing this. You can also use long-handled sponges to help you with bathing. Long-handled sponges allow you to not have to bend down as far if you have hip precautions after a hip surgery. They also allow you to reach parts that are often hard to reach, like your back or behind yourself. Like I said before, to reach down to your feet. And these are very helpful. They come in many shapes and sizes. Here we have a sponge. It's an actual sponge. Here we have a loofah that can also be used. Handheld shower heads are another piece of adaptive equipment that is often used when bathing. When using a shower bench, the water from the shower head can often come down and spray directly in your face. Easily attaching one of these to your shower head can redirect the water from your face, and you can also use this to easily rinse off your body. Thank you for viewing these videos on the use of adaptive equipment for bathing.